Well, let's return to the NHS now as the government announces plans to use private sector health clinics to help tackle NHS waiting lists. 13 new community diagnostic centres will be opened across England, 8 of which will be independent. Joining me now from Leeds is the co-chair of Keep Our NHS Public, Dr. John Puntis. Dr. Puntis, good to see you this afternoon. Will this reduce NHS waiting lists?
No, I don't think it will, and it's a very disappointing announcement. I mean, I think it's about as intelligent as the commitment to net zero on the one hand and then opening up 100 more oil wells. The health policy makers should really be asking what is the best way of providing comprehensive, effective healthcare for the population. We know the NHS is in a mess at the moment, and this is driving people to want to use the private sector. But, 10 years ago, the NHS was being ranked as the best amongst the most developed countries in the world. So the question has to be, what has gone wrong? And the answer to that is clearly severe, chronic underfunding and lack of long-term planning. Now, the private sector is small. It's parasitic on the NHS. It depends on its staff from the NHS, and it doesn't really have extra capacity. If surgeons and anaesthetists working in the NHS go and work in the private sector, they're not working in the NHS. This business about spare capacity, I think, is highly suspect. During the last few years, we've seen something like 6,500 patients transferred each year from private hospitals to NHS hospitals because they can't cope with sick and complex cases.
So what you're saying is you think that patients who believe that they're about to short circuit a long waiting list by going to one of these clinics are just effectively being fobbed off and they won't get treated. Is that what you're saying?
Yes, I am saying that. And this is an ideological obsession with outsourcing and giving monies to the private sector. All that means is you get a less good service, and some money that could have gone to building the NHS is siphoned off to shareholders. And this is completely the wrong approach. We need to invest in the NHS. That is the only long-term solution. Invest in the NHS based on its original founding principles, which I think have stood the test of time.
But longer-term investment strategies, by their nature, take time, don't they? What short-term things could be done to help try and reduce those waiting lists, would you say?
Well, I think the first thing would be to look at staff retention and give them a decent pay rise. You can't do anything if you don't have staff. And at the moment, there's something like 120,000 vacancies. And it's clear that many people are leaving the NHS. And in fact, if you look at the private sector, it doesn't train any staff. It has about 17,500 doctors that work for it, trained by the NHS. That's effectively something like an 8 billion subsidy because they haven't paid the cost of training. And diagnostic centres sound great, but where do the staff come from? They come from the NHS, so they either leave the NHS or they reduce their hours in the NHS. And then the work that they were doing isn't being done. It's just being changed to a different place. So I think, although it sounds plausible, the government have run down the NHS and they're saying, look, the private sector is the alternative. But building up a two-tier system where people who can afford to pay, for example, get good care, and those who don't are dependent on a rundown NHS is not the wrong way forward. It's not the right way forward.
But if it was shown that it helped reduce waiting lists, even if it was marginal, but that they were coming down, could you support it? Or are you so ideologically opposed to this as being part of a slippery slope to selling off the NHS that you would never support it?
Well, I think one has to look at the evidence. And as I said, thousands of patients each year are transferred from the private sector to the NHS. That doesn't fit comfortably with spare capacity. Private hospitals are small. They average 45, 50 beds. My hospital where I worked, 1,500 beds. 1,100 consultants, multidisciplinary teams managing complex cases. That is not something that the private sector can do. And you reduce accountability, you increase costs, administration costs, and frankly, the private sector is poorly regulated and it has a poor safety record. So all of these things, I think, need to be made clear to the public before you start saying we're going to put £19 billion into the private sector and not invest it in a public NHS.
Dr. John Puntis, thanks for talking to us on Sky News.
Thank you.